When do high-risk individuals need a biopsy for stomach cancer screening? Imagine a situation where early detection can make all the difference. For people at high risk of stomach cancer, this is often the case. These individuals usually need a biopsy during an upper endoscopy when screening for early signs of trouble. During this procedure, a doctor inserts a thin, flexible tube with a camera through the mouth to look at the esophagus, stomach, and small intestine. If any abnormal areas are seen, such as unusual bumps, ulcers, or irregular mucosa, a small tissue sample called a biopsy is taken. This sample is then examined under a microscope to check for precancerous changes or cancer cells. So, who exactly falls into the high-risk group? People with certain precancerous conditions like chronic gastric atrophy or intestinal metaplasia are considered high risk. These are changes in the stomach lining that can sometimes develop into cancer over time. Others include individuals with pernicious anemia, a condition affecting stomach cells, or those with a family history of stomach cancer. Certain genetic syndromes, such as hereditary diffuse gastric cancer or Lynch syndrome, also increase risk. People who have had part of their stomach removed previously or come from regions with high stomach cancer rates are also more vulnerable. These factors make it important to keep a close on their stomach health. The main screening method for these high-risk individuals is upper endoscopy. This procedure allows doctors to see the stomach lining directly. If during the endoscopy, suspicious lesions like ulcers, nodules, or areas of abnormal mucosa are identified, a biopsy is performed. Additionally, if someone has known precancerous conditions like atrophic gastritis or intestinal metaplasia, biopsies are often recommended as part of routine surveillance. The goal is to catch any early signs of cancer before symptoms appear, which can significantly improve treatment outcomes. The timing and frequency of biopsies depend on each person's specific risk factors and findings. For example, if someone has extensive atrophic gastritis or intestinal metaplasia, they might undergo endoscopies with biopsies every 1 to 3 years. This regular monitoring helps detect any progression toward cancer early. It's important to remember that biopsies are generally safe, but like any medical procedure, they carry small risks such as bleeding or perforation. However, the benefit of early detection usually outweighs these risks, especially since stomach cancer often isn't noticed until it's advanced. While biopsies are the definitive way to diagnose stomach cancer, emerging non-invasive tests like serum pepsinogen levels and Helicobacter pylori serology can help identify people at higher risk. These tests are useful for initial screening but do not replace the need for biopsy when suspicious findings are present. In summary, high-risk individuals need a biopsy during an upper endoscopy when abnormal or suspicious areas are seen or when they have known precancerous conditions. The decision on when and how often to perform biopsies depends on individual risk factors, clinical findings, and established surveillance protocols. The main goal is to detect stomach cancer early, when it is most treatable, while balancing the small risks associated with the procedure. Always consult with healthcare professionals for personalized advice, as they can tailor screening plans to each person's unique risk profile.